All right, so welcome to the America East Three-Pillar Academy, where I'm very excited to have Tim Neal with us to shed some light on mental health and student athletes and all of the concerns that we've been seeing as a national trend over the past few years. So Tim, prior to our phone call today, you've been the Assistant Director of Athletics for Sports Medicine at Syracuse, a lengthy stint with 14 years, and are currently an assistant professor at Concordia University. And you've also been recognized as the NATA Most Distinguished Athletic Trainer, so congratulations on that. And you're absolutely one of the leaders and innovators of athletic healthcare, athletic risk management, concussion assessment, a litany of other things, and specifically what we're talking about today is mental health considerations. So we really thank you for taking the time to join us, and the floor is yours.
Oh, thank you very much. I'm happy to be here with everybody and have this discussion about athlete mental health, which is a very, very important component of overall health for the student athlete. I think what I'd like to discuss to start off with, and then allow more time for questions, would be to give you an overview of the prevalence of mental health issues in the United States, reminding people that athletes are not immune from mental health disorders, talk about some of the unique stressors we know they go through. Then let's talk about some triggering mechanisms that might create a problem for a student athlete, some things to look for in their behavior, and how do we set up a referral mechanism. So we know that in the United States that 1 out of every 4 young adults and adolescents, 1 out of every 4, can meet the criteria for a mental health disorder. And that can cover the entire spectrum of mental health disorders, from anxiety, depression, to eating disorders, to anger management issues, the entire spectrum. So all of those things are prevalent in young people. Having an awareness that 1 out of every 4 athletes or 1 out of every 4 college students could be at risk for a mental health disorder does a lot of math for people. So if you have 100 or let's say you have 600 athletes, your population of potential people with mental health disorders could be 150. So you need to have that on your radar screen. Secondly of all, we know that athletes have unique stressors on them. They have to not only meet criterion to be eligible, but they're always scrutinized by their coaches. They are being scrutinized by their classmates who give them grief in classrooms. I can recall many athletes that I worked with at Syracuse would come to practice and they'd be upset because someone in their math class ripped them for missing a free throw late in the game. And so they're under excess amount of scrutiny, more so than the general student. They miss holidays, they miss summers, they miss family occasions because they're in regular season, off season, they're in year-round training. They face the specter of overtraining in terms of continuously working out, which makes them prone for chronic injuries. And we know from studies that people who are constantly in pain or having injuries, it does wear on them from an emotional standpoint. We also know from data that a vast majority of people that can experience a mental health disorder don't go for help. Usually 1 in 4 of those who do suffer from mental health issues seek help. So there's 75% that do not, but they're giving out signals on their behavior that they may have a problem. We also know out of a study out of Columbia that only about 7% of athletes go for counseling because of the stigma of mental health, which we're still trying to address. And I think one of the things that people can talk about with an athlete when it comes time to discuss counseling would be 3 things that I always discuss with athletes. Whenever I approached an athlete that I thought could use a mental health evaluation and they were kind of hesitant to go, I bring up 3 things. Number 1, what counselors do or a mental health care professional does is they give them the proper evaluation and diagnosis. They are specifically trained to detect from signs and symptoms what a disorder is. Secondly of all, what they do is they teach the patient, the athlete, what are your triggering mechanisms that would make your depression or your anxiety worse. So that helps them identify situations they may enter to better prepare themselves for the third step, which is they teach them coping mechanisms. So before a test or before a game and you feel anxious and you're getting short of breath and you're getting dizzy, here are some coping mechanisms to help address your anxiety. Or if you're feeling sad or you're feeling worthless as a result of being yelled at, for example, here are some coping things to keep in mind. So what we're trying to do is try to help that athlete normalize their life and destigmatize any mental health disorder, because it's really no different than having asthma or diabetes. It's just a condition that you have. So with that, what we try to do is we try to teach athletes, athletic trainers, coaches, administrators, parents, behaviors to monitor. And oftentimes people will look at somebody misbehaving or acting out in a way, and they'll say, what's the matter with Tim? What's going on with him? Really, the question should be, I wonder what has happened to Tim, or I wonder what he's dealing with that makes Tim act that way. So instead of stigmatizing someone's behavior, saying, boy, what a jerk, you should be thinking to yourself, I wonder what's going on with Tim, or what he's feeling to make him yell at people, or why is he angry, or why is he withdrawn? I wonder what's happened to him. And if you approach it from that aspect, I think it's very, very helpful. I think the next step you want to look at, and this is the hardest part for people, is how to approach a person with a concern about their mental health. Certainly, if you saw somebody limping, you would not feel hesitant to walk up and say, hey, what's the matter with your foot or your knee or your ankle? But when you see somebody acting out, whether it be in anger or being withdrawn, fighting, whatever it might be, that's not like their personality, or they're doing things that are harmful to themselves or others, you're going to feel a little anxiety going and talking to them. But one of the things you can ask them is say, hey, how is life going for you right now? Don't say, how's things going? Because they'll say, fine. You ask them, hey, can you describe how life's going for you right now? Can you describe for me what's going on right now with you? And they'll say, what do you mean? And then that gets you to your chance to say, look, I know you to be a nice person. You usually don't do A, B, or C, or D. I can recall many times as a clinic athletic trainer, working with hundreds of athletes that have had mental health problems across the spectrum, from suicidal athletes to those who cut themselves to eating disorders, et cetera, et cetera. And let me digress for 1 second. People who have comorbidities, they have one or they have two or more conditions going on at the same time, are about 40%. So if you have 10 people with a mental health disorder, 4 of those 10 will have 2 or more conditions going on. They're going to have depression, anxiety. They can have anxiety, eating disorders. They can have whatever. The 2 worst disorders to have in combination, which raises the specter of suicide, 50% of those with comorbidity of eating disorder and substance abuse. Those 2 comorbidities together raises the suicide rate or suicide attempt rate to about 50%. So for those of you watching this, especially administrators or athletic trainers, if you have a disordered eating program, you should have one. If you have a drug testing program, what I would recommend you do, and what my practice has been, and what I've recommended to other universities is, if you have identified someone with an eating disorder and you're treating them, you should routinely be drug testing them to make sure that other comorbidity is not present in order to lessen the likelihood of a potential suicide. So let's go back to our behaviors to monitor. You are looking for someone who is acting out in a way that could be either harmful to themselves, others, or detracts from their normal lifestyle, meaning they're not studying, meaning they're not working out, means they're late for class, they're late for meetings, they're getting forgetful, they seem angry, they may be using substances or abusing alcohol. They may feel withdrawn, or someone perhaps who in the past has been very quiet is now very verbose and acting out and clowning around. So what you're doing is you're trying to get a measurement of how that person was before, and now something has happened. Now they're a little bit totally different or a lot different than they were in the past. So you want to look at those behaviors. So I can recall many times I would walk up to athletes and say, hey, just come into my office and talk to me. And it wasn't because they were in trouble. I just wanted to learn more about them. I've helped a lot of them go to law school and in medical school. I've helped many get into officer candidate school, et cetera, et cetera. So it wasn't like a stigma to come and talk to me, or I would go in the hallways and just talk to the athletes. And I can recall watching a football player acting out in practice, getting in fights, and after everything's calmed down, I walk by him. I just say, hey, come see me after practice. So he walks in my office. He says, what's going on? I said, can you explain to me what's going on? Is there something going on that we need to know about? Because that's not you. You usually don't fight. That I'm straight, I'm fine, everything's okay. I said, okay, if you want to talk or something going on, just come back and see me. 10 minutes pass, he walks back in, he shuts the door and goes, how did you know? I said, I know you to be a quiet, nice person. You're out there using words I've never heard you use before. You're tearing guys' helmets off. So what's going on? And sure enough, his parents were going through a divorce. He's having a lot of struggles with that, struggles with his girlfriend, and he was manifesting his anxiety through his behavior and not verbally. So we need to look at their behaviors. And then lastly of all, you need to set up a system working with your team physician, working with your counseling services, working with your community mental health care professionals, and setting up a referral mechanism to get your athletes in. And educating the counselors and the mental health care professionals about athletes and a lot of the dynamics they face. So once you help set that up, you're able to expedite care for your athlete. So you want to develop a relationship before you really need them. I would call down to the counseling center twice a week, not even referring anybody. I know what time to call them near the end of the day, so they'd actually vent to me. And, well, Tim, we're getting overrun down here. And so it was a relationship. It wasn't just like, I need something. So you have a relationship with those people.
Great. Tim, thank you for giving us that overview. If anybody out there on the internet has any questions, please feel free to post them to the America East Twitter account and use the hashtag 3P Academy. So feel free to chime in. I know there's pockets of you out there, so let's hear your questions. But Tim, if I'm a student athlete and I'm a captain, and how do I best encourage positive mental health and well-being within a team?
It's a great question. One of the things, that I would talk frequently about all athletes, not only in team sessions, but also to captains and other leaders, was to emphasize that there is no good health without good mental health. So if you're a captain and you want to foster a successful environment on your team, what you're going to try to do is everybody's, of course, is encouraging to do well physically, but we want to talk about our own mental and emotional health. And it's okay to feel anxiety. It's okay to feel depressed whenever you don't play well. But those are situational things. And you want to express that to your teammates. Say, it's okay to feel down. Yeah, you make mistakes. I've made mistakes. Excuse me. But we have tomorrow. We have these other things we got to look forward to. And we can't dwell too much on it. And to try to set those things up in terms of everything is temporary. People in life in general should borrow from the addiction world. And here's what I mean. People who are recovering from addictions, they are not taught you can't drink anymore the rest of your life. They're not taught you can't use cocaine the rest of your life. They teach them, don't drink today. Don't use cocaine today. And the same thing is held over for psychology. Try to control your emotions today. Don't worry about what you've done in the past. Don't worry about tomorrow. You control what you can control today. And if team captains can get out there, and I think coaches give this message, but hearing it from a peer is really, really vital. Control your emotions today. Today is the only thing you can really worry about. Tomorrow, we worry about tomorrow when we get to tomorrow. So it doesn't look as daunting to people. The same way they teach the same thing with people in diets. Control your diet today. Don't worry about tomorrow not overeating. Just worry about today. So I think if captains and people will do that in general, that's very helpful.
Great. That's a great answer. Focus on what you can control for this time set and worry about the rest later. I think that's where students get caught up in with anxiety and what about this and what about that. That it's really great advice to just focus on what you can do for for the one day. As an administrator, what policies and protocols should we have in place to best help our student athletes who are struggling with mental health? I know you said build connections with counseling centers, but what specifically might be helpful as well?
I think something that can be very helpful is to work with your sports medicine staff, your legal counsel, and your risk manager, and you should go get the 2013 NATA consensus statement on developing a plan to recognize and refer student athletes with psychological concerns at the collegiate level. I was the chair for that, and it was based on the work I did at Syracuse University. And what it is just you want to build your own plan that is written, that's given to all the coaches, sports medicine staff, administrators, all the stakeholders at the university, and have it all, approved by all the stakeholders. And you're educating your student athletes so you have a plan in place for how do you refer. What if you'd be surprised how many universities don't have an emergency mental health care plan. An athlete says, or a student in general says, I'm going to kill myself. What is your plan? You'd be surprised how many universities don't have that. So you should have an action plan. If a student comes up to a professor or an RA or whatever and say, I'm thinking about harming myself, this, that, and the other thing, what number do you do? What do you take the person? Would you stay with them? What do you do? It's all spelled out in this protocol. And you can take this and we had tremendous writers on this. And as the chair, I had it formulated so it's ubiquitous. It can be used at any level. You don't have to have all these big counseling people or big budget to do this. You can do it at Division III level, NAIA level, Division I level. It doesn't matter. That way, you can cherry pick things based on your dynamic to develop your own plan. And the other thing I tell administrators, and I know a lot of athletic directors, I tell athletic directors one of the most important things you can do is get out of your office. Walk the halls. Be visible. Be approachable. So athletes will come up and they'll feel comfortable talking to you. That's what I did as an athletic trainer. I would walk the halls when I wasn't busy and just talk to the equipment staff or talk to the student athletes. So they always felt comfortable coming to me or stopping me and say, hey, can I come talk to you later? I got this issue. Sure, you got time now? Let's go to my office. So if you're more approachable, more people will come to you with their problems.
Yeah. It's great advice. Let them see you, not necessarily seek you out.
Exactly.
Yeah.
Right.
Yeah. So I'm giving you questions from all different angles here. So as a student, athletic trainer, how should trainers help athletes stay motivated throughout the season of rehab while keeping a positive mindset?
Well, it's interesting you said it because I just came from doing a rehabilitation session with one of the athletes that was injured and just had ACL surgery. She's off to a great start. And I think one of the reasons why is because you're educating her not only physically, but you're educating her emotionally. And I go back to what you learned from the addiction people. She's more concerned, in the beginning, she's concerned about coming back and playing. What I say, you can't really affect that right now. The only thing you can affect is what we're doing right now in this time frame, today and the next week, based on your phases of your rehabilitation. So concentrate for the hour and a half while you're in here. But more importantly, when you go home at night, I'm going to give you some basic exercises for you to do to maintain what we've gained. It's all stepwise. And the only thing you can do is get worried thinking long term. And then what you do is when they come back in the next day, you praise them and encourage them. Say, look, you're right where we want you to be today. You did all this stuff yesterday. Your motion was great. You maintained it overnight. Now we can build on it. Good job. And then you move from there to there and you focus on that day.
Great. Thank you. Thank you. It looks like we have a question from Twitter. Kathy has joined us. How do we support athletes who aren't meeting team expectations due to mental health issues? I know you get a lot of team dynamics involved with that, and how come he's not here? Or why is she missing this? And you're trying to care for the student athlete. So how do you manage those expectations?
I think this comes down, I get this question from time to time. People want to know, where is Tim, for example? Well, Tim's got a mental health issue, and it's confidential, just as if it was like an illness or an injury. I've talk to athletes. I said, if you talk to your coach, you talk to your parents, or you talk to your teammates about this. I don't tell them they have to. Now, the only time you break confidentiality is when they threaten to harm themselves or others. Then there's a protocol in place based on your university saying, okay, confidentiality only goes so far, but now you've threatened to harm yourself or others. I'm now compelled to make sure we notify people because we have a concern for you, for your safety and your welfare. But otherwise, sometimes some of these athletes have problems because the coaches' expectations or the way they're treated by coaches can exacerbate an existing mental health problem. In your pre-participation physical examination, you want to ask questions relative to your mental health. And in cases where I've worked, athletes notify you they have anxiety, depression, or on medication. We met them off the we weren't doing it during the physical examinations. We'd have them come back and meet with us privately, to letting them know about our counseling services, about anything else we can help them with, and our doctor would help monitor their medication. So it wasn't like we knew about it and didn't act on it. Once we knew about it, we acted on it and were there to support the athlete. But we never talked about it. If someone's in counseling and they don't want anybody else to know, it's a medical thing. If they want to know, it's a medical thing.
Yeah. So you brought up a good point, and you talk about pre-assessment, and what does that look like? Because not everybody wants to disclose right away. Here I am, the new freshman, and nothing's wrong, and I'm great. Sometimes they won't disclose physical ailments, let alone mental ailments. So what have you found to be successful in this pre-assessment period? Is it questionnaires? Is it kind of what does that look like?
It is generalized statements. There's like 10 or 15 questions, and you can go find them. We listed them in the consensus statement, and I helped put together a list of questions for the NCAA. They're doing a lot of great work with the leadership of Dr. Handline in this area on mental health. So you ask them, and if you're getting positive answers, then you can go to more specific questionnaires relative to drinking, relative to eating disorders, relative to anger management issues. And then once they fill those out, they can be further evaluated by the team physician, or if you have a certified and licensed sports psychologist, they can evaluate that and then refer them as necessary. Now let me say one thing about the sports psychologists. There are parameters to becoming a real licensed sports psychologist. You have to first be a licensed psychologist in your state, a PhD, a PSY. You have to be licensed as a psychologist. Then you have to have specific education by the American Psychological Association, Division 47. And that entails more coursework and more experience dealing with athletes. To have someone come in with a psychology background, or a former athlete coming in and say, I'm the sports psychologist, you're not a psychologist. You might be a performance enhancement person or whatever you want to title it, but to call someone a sports psychologist when they are not, and you utilize them as a university, something goes bad, you can be held liable to holding somebody out legally that they're not. So a word to the wise, make sure they hit all those benchmarks.
Yeah, that's really important. I know it's a lot of institutions are looking to, especially a lot of athletic departments are looking to hire somebody on staff in that field. So having that background will be helpful to everyone as we continue to look at and vet through some of those applications. So from an administrator perspective, how can we protect student athletes who need help, but they don't want their coach or their parents to be involved?
By doing exactly what you just said, making sure they're receiving the proper mental health care that they're seeking. In the hundreds of athletes I've ever talked with about all these issues, I've never had one not let their parents or coach know. I think you can approach them and say, your coach, they do care about you. They say, oh no, he yells at me, he calls me names and stuff. I said, that's his way of communicating. But I know he has a concern for you. I know he has concern for for your teammates when they become injured. This is not an easy subject for anybody to talk about. And once they realize that, they'll go, and I've actually gone with athletes to go talk to their coach about it. And all I'm there is just someone to support them, answer any generalized questions, not about the kid, but about mental health in general, and what is our process to help. I don't really get into the other stuff.
Great.
And I would say this for athletic trainers who are watching this, we are not counselors. I know a great amount about mental health. I don't counsel people. I'm not trained in that. I'm not licensed to do that. My role is to recognize it and encourage people to go get help.
And so how do you, as an athletic trainer, and this is a great question, if, a couple thoughts just popped in ahead. You talked about sometimes coaches might be triggers for students' mental health issues. And as an athletic trainer, you see that. How do you work as part of that support team while still maintaining those relationships with the coach, with the athlete, and you feel like you're kind of caught in the middle a little bit?
I think one of the ways you do that is preemptively have coaching meetings talking about mental health and talking about certain triggers and behaviors that can set people off. And I think that the challenge you have in dealing with coaches is they've been very successful as athletes, and they usually do what they did as athletes. And I will tell you, I work with coaches who are pretty darn tough mentally. They can handle adversity and things of that nature. It's the ones who can handle adversity very well, but think everybody should handle it the same way they do, are the challenge. I'm not soft, they shouldn't be soft. What we have to teach people to do is to look at everybody as a unique individual, and not everybody is the same. They're like snowflakes and they're like grains of sand. There are no two that are ever the same, and how people react to different kinds of pressures is all different. And that's what I express to coaches. And I've had a few coaches that I've had issues with, and you try to continue to educate them. But by and large, once you educate the coach and express to them that, this is really an important part of it, they get it, and they're there to support or help in any way.
That's great. That's great. We have time for about 2 more questions. So if anybody in the 3P Academy has been holding back, please feel free to send your questions in. Let me see here. So as a student athlete, you gave us some advice as to how to approach a teammate about issues, or if they're withdrawing from the team. Is there anything, I know like peer-to-peer, those conversations can be a little bit harder than, an administrator or an athletic trainer approaching a student athlete. Is there any advice if it's a peer-to-peer conversation?
I would just say if you detect, somebody who may need help, which I think was really important for athletic departments to do and athletic trainers, is to educate the student athletes on it. I would educate them every year in their team meetings, but I would bring people in to talk to groups. So you can normalize going and seeing a counselor or a psychologist or whatever it might be. And I know universities that do have them, and a psychologist is around all the time, like a part of the coaching staff, but they're not part of the coaching staff, but they're around, so they're approachable. For the student athlete looking to help the other student athlete, I've actually had student athletes walk in with other student athletes in my office and say, "Can we talk to you?" I said, "Sure, come on in." And they shut down. They say, "Tim, my teammate's here. I've had these issues," and they did in the past, and I don't talk about anybody else, but they'll say, "Mr. Neal, I had these issues. I think my teammate here has the same issues. We talked about it. I'm going to step out. Can you just talk to her about what the resources are?" And that's a great way of doing it, to walk in with somebody else, to talk to somebody and say, "Hey, look, I have a concern for my teammate. I'm here to support her. Can you talk to us about some resources?" And I'll step out and you guys can talk. And that's what I used to coach people up to do.
Yeah, I think sometimes there's safety in numbers.
Yes, exactly.
Yep. So, Tim, at this point, I want to thank you for joining us today. I don't know if there's any summarizing thoughts that you want to share as we conclude this session.
I would just say that, again, there is no full health without good mental health. And just as if you're having a physical problem, if you're having an emotional or mental problem that needs to be addressed, you should try to help that athlete or even yourself who's watching this go out and try to seek care for a mental health professional. And you can go see somebody and it may not work for you. That doesn't mean you should stop. It's like if you have an ACL injury and I go to an athletic trainer for rehab or a PT and it doesn't go right, go to somebody else that'll help make gains for you. So don't just try it. If it doesn't work, give up. There is no giving up.
Right. Absolutely. There's no giving up. Find the one that fits. Just like when you were being recruited for schools, you just found the one that fit.
That's exactly right.
Well, Tim, thanks again for spending this time with us today. It was very knowledgeable, and we learned quite a bit. So I'm hoping that we'll see some trends and some enhancements in what we're doing in the America East as it relates to mental health and our student athletes. So thank you.
Thank you, and I commend you for doing this because I think it's a great service for your athletes.
Great. Thank you, Tim. Have a good afternoon.
Thank you.